What is a partial anomalous pulmonary venous drainage? So the connection is normal. The pulmonary veins are directly ending to the left atrium. But what happens? This atrial septum is slightly shifted towards the left. So it looks like it is actually draining into the right atrium. Not because the end is connected to the right atrium, but the atrial septum is shifted leftward. So this is abnormal physiology with normal anatomy of the pulmonary venous draining. Common atrium with no development of septum, both the atrial chambers remain as a single chamber with the admixture. This commonly presents with cyanosis. It is associated with heterotaxy syndrome. ASD is a very common congenital heart defect it occupies more than 10% of all congenital heart defects. So ASD occurs in 1 in 1000 live births. Incidence can be compared to TOF, which occurs in 557 per 1 million live births. Physiology. The shunt of the ASD, left to right shunt, is determined mainly by two components: the compliance of the respective ventricles. So the LV pressure, which is determined by the either LV wall pressure or aortic pressure, and the RV compliance, which is determined by the pulmonary arterial pressure. So what happens to the ASD flow? At birth, immediately after birth, the pulmonary arteries are not open. Once the baby starts crying, the pulmonary lungs open. That means the pulmonary artery flow increases. So once the pulmonary artery flow increases, there is drop in the RV pressure and RA pressure. So there is ASD flow from the left atrium to the right atrium. The flow begins. There is atrial septal defect. So our right-sided pressure is less than the left-sided pressure. So flow will be from the left to right. What happens when the baby grows? During infancy also the same thing happens. Once the pulmonary arterioles are progressing to grow, that is, their resistance is reducing, RV compliance is very good. So the flow is from the left to the right. What happens? There is during adulthood at around 20 years of age. This unfortunate event happens only in females predominantly. At about 20 to 30 years of age, because of persistently increased flow through the pulmonary arteries, they develop reactive pulmonary arterial hypertension, which can even progress to obliterative pulmonary artery hypertension. So what happens? The pulmonary artery has been tolerating lot of flow throughout this adulthood up to 20-30 years of age. They start to react to the increased blood flow. Initially, this reactive hypertension is reversible either to oxygen or nitric oxide or milrinone, which is reversible if the ASD is closed at that stage. But later, after a certain period of time, it becomes obliterative. That is, the pulmonary artery becomes solid. It is no longer reactive to whatever management we are going to do. Either closure of ASD also will not result in the reversibility of the pulmonary artery hypertension. So at 20 years of age, when the pulmonary artery hypertension develops, there is increase in the PA pressure, which results in increased RV pressure. That is, becomes less compliant. So the RA pressure increases. So what happens? RA pressure tries to equalize with the LA pressure. So the flow between the left to the right, it stops. Left to right shunt reduces or completely stops. What happens? Still worsening of pulmonary artery hypertension, there is reversal of the shunt. When the RA pressure exceeds the LA pressure, there is flow from the right to the left. This is called Eisenmenger syndrome, which is the first identified cyanotic component in a shunt lesion. It's called Eisenmenger syndrome because of reversal of the shunt from the right to the left due to development of obliterative irreversible pulmonary artery hypertension in the adulthood.